Good evening and welcome to our COVID-19 update. I'm Ladi Akure. Here are the highlights at this hour. Federal government says Nigeria hasn't reached the peak of COVID-19 infections yet. Vigilance remains key as pandemic hits 689 local government areas. More exit classes students resume across the states. Preparations and compliance remains mixed. Lebanese hospitals near full capacity from COVID-19 cases as entire government led by Prime Minister Hassan Diab resigns. Five of Nigeria's 36 states and the Federal Capital Territory account for 60% of the cumulative COVID-19 cases nationwide. And that's according to the chairman of the Presidential Task Force on COVID-19 and Secretary to the Government of the Federation, Boss Mustafa. Speaking today during the Presidential Task Force briefing in Abuja, Mr. Mustafa also says 689 of Nigeria's 774 local governments have reported cases and only 85 are without any case or have anyone tested positive for the virus.
Now we have infections right into the rural communities and localized areas. The watchword is vigilance and taking extra care. Nigeria is yet to reach the peak of the pandemic. Therefore, the low test case confirmation numbers coming out daily should not be misinterpreted to mean that we have overcome this virus. We have over time ramped up testing, but more needs to be done to raise the quantum of tests per million. Going by the surge and the growth in our figures, do not rule out the possibility that very soon all the 774 local governments in Nigeria will report a case or two of COVID-19. The PTF is happy to note that many survivors are telling their stories and sharing them in the social media. The stories of those who doubted the existence of the virus and became unfortunately infected are now expressing appreciation for timely intervention of the case management team. That provides a compelling proof that the virus is real.
Meanwhile, National Coordinator of the PTF, Dr. Sania Liu, says the members of the task force were dismayed with the level of compliance witnessed at the burial of Senator Buruji Kashamu over the weekend. Dr. Liu is urging traditional and religious leaders to help the government in speaking to their community members on the importance of adhering to safety protocols, especially the use of face masks and social distancing during this period.
I must say we are quite dismayed with the level of compliance when it comes to some of these activities. And the issue is, we know that COVID does not act like a proper pandemic. What do I mean by a proper pandemic? If you have a proper pandemic like Ebola, as I've always said, you will have dead bodies on the streets, you will have people bleeding to death. So that shock factor is there, and you do not need to do anything further to convince people to protect themselves and to do the right thing. So ab initio, right from the beginning, we are faced with a pandemic that's an invisible enemy. We are facing with a pandemic where the majority of us will probably never come across somebody with COVID or somebody who may have died from COVID. So right from the beginning, we are faced with the task of convincing people to change their behavior, to change their risk perception with regards to a pandemic that is not as visible as other pandemics have been. We have been very lucky in this country. We haven't had the sort of deaths or mortalities that we have seen in other countries. But nevertheless, a lot of people have died. Close to 1,000 Nigerians have died that may still be with us today, if not for COVID. And I think the problem is not with the message. Maybe the problem is also with the messenger, with the way we communicate, who is really delivering that message through. It's certainly more effective to have the traditional rulers, to have the religious leaders, to have your village heads, to provide that information that would enable you to protect yourself. We must definitely have to continue to engage Nigerians, enlighten them, and also encourage them to take those simple steps that are necessary to protect ourselves and our loved ones.
On his part, the Minister of State for Education, Emeka Nwachukwu, has commended the performance of most of the school administrators with reference to adherence to safety protocols and guidelines. He, however, says he's not comfortable with the attitude of students as they tend to forget the guidelines when meeting with friends after classes.
Only part we are not still very comfortable with is students themselves. Once they get out of class, they begin to behave like young people as well. So that they get together, hugging each other and playing. There's no way around that one because we can't sleep with them, drink with them, or flog them for being socializing with one another. It's almost very difficult. So in all the schools, all those things that need to be done physically. I inspected many of these proposed sick-based isolation positions, everything that we asked them to do. The directors of FECAS, or what we call our Quality Assurance Unit of the Federal Ministry in all the states, have reported positively. I met repeatedly with commissioners of education, and on Monday last week, all of us reviewed what they had done. On Wednesday, I met with all the governors, and I also commended what they had done. Many of them had already gone way ahead of us before we did this. So there's a unanimity around the country to try to give our students and our children the best, put their first foot forward.
Going to the schools and the states themselves, and starting off in Jigawa State, which has ordered the reopening of all schools for final year students only, and vows to close down any school that fails to comply to COVID-19 measures. Its Governor, Badaru Abubakar, made the announcement while speaking to Channels Television after he inspected some schools in the state capital, Dutse.
Hand washing, wearing a face mask and social distancing is the new order in schools across Jigawa State as final year students return to prepare for their examinations. 40 schools, including 10 private schools and 30 public schools, were given the green light to reopen for the final year students.
As I was coming inside the first day, today I was coming out, they put sanitizer outside the door. Before I come inside, they say I should wash my hand. You use thermometer to measure my temperature, if my temperature is high or not, before I come in. After that, and they confirmed that my temperature is not high.
After inspecting some schools in the state capital, the Jigawa State Governor said he is hopeful that Jigawa will get it right.
All the arrangements put in place in protecting our children from COVID-19 are there. I have seen the buckets, the soap, and all the children have been provided with face masks. And also, there is enough social distancing in the classrooms. I think the ministry have done well.
The essence why the method comes into existence.
The Commissioner for Education vows to shut down any school that flouts the guidelines on COVID-19 protocols.
But in the time when we are going for inspection and monitoring, if we find that no social distance of that, no face mask or other protective things are not provided, then we'll definitely call them to attention. And if the compliance is not there, then we'll ask them to close.
As schools resume across the state amidst the pandemic, it is expected that all measures are adhered to for the safety of the students, their teachers, and families.
In Yobe State, SS3 and GSS3 students have fully resumed academic activities after almost 5 months of forceful stay-at-home due to the COVID-19 pandemic. Channels Television's visit to some of those schools revealed that safety measures have been put in place, while some other schools now have mini isolation centers.
5 months after schools were shut down due to the novel coronavirus, hopes are now rekindled as exit classes resume academic activities in Imo State. At Government Girls Unity College, Damaturu, safety measures such as temperature check-in, use of face masks, as well as hand-washing facilities are provided at the school gate and other strategic locations. As part of measures to observe social distancing, 4 students are accommodated per room and 20 students per class. A 16-bed mini isolation center is also provided.
All the needed items are on ground now. You can see with yourself. I just came in and washed my hand, do everything. So even in the hostel, we have provided safe place with 2 beds or 4 beds, whereby if there is any case, we will admit them before taking them to general hospital. And we don't pray that will happen.
As for the exiting students, returning back to school is a cheering moment.
I'm really happy because we've spent 4 to 5 months at home doing nothing, but I'm really happy now that we are back to school.
We spent more than, let me say, 3 to 4 months doing nothing at home, but now we are back to school to do our work and echo. So we really thank the government.
The teachers ask the students to be dedicated to their studies.
And I would like to inform the students that they should be serious with their studies because government has put in everything that is needed for their safety in the schools.
49 public schools, including those relocated to safer areas due to the Boko Haram insurgency, have resumed academic activities ahead of their examinations.
Let's see some of the COVID-19 figures as announced by the Nigeria Center for Disease Control within the last 24 hours. 437, that's the number of new confirmed COVID-19 cases in the country, with 142 patients discharged and 3 fatalities recorded. The latest confirmed cases are in 16 states and the Federal Capital Territory. Lagos leads with 107 cases. The FCT has 91, Plateau 81, Kaduna 32, Ogun 30, Kwara 24, Ebonyi 19, Ekiti 17, Oyo 8, Borno 6, same as Edo, but Kano has 4, Nasarawa, Osun, and Taraba have 3 each, while Gombe has 2 and Bauchi 1. The NCDC puts the total confirmed cases at 46,577, total discharges at 33,186, and 945 deaths, with 12,446 patients still receiving care across various COVID-19 isolation centers in the country. Lagos, the Federal Capital Territory, Oyo, Edo, and River State are the top 5 states with the highest number of COVID-19 cases in the country. As graduating students prepare ahead of the August 17th examination date, those seeking admission into tertiary institutions now have a definite date for their post-UTME screening. The Joint Admissions and Matriculations Board, JAM, has fixed September the 7th for the commencement of screening across the nation's tertiary institutions. Its registrar, Professor Ishak Oloide, made the announcement at a meeting between JAM and vice-chancellors, rectors, and provosts of tertiary institutions. According to him, the screening will be held twice, September 7th to October 4, and then it will be held for the second time on the 18th of November to make provisions for those taking their school certificate examinations. Over in Imo State, students in exit classes in the state are yet to resume as they wait for the state government to give that directive. The Commissioner for Education in the state, Bernard Ikegwoha, while speaking to Channels Television earlier today, says the delay is to ensure that government puts all modalities in place to ensure the safety of the students and everyone else involved in the school system. Eitokwe Kutei has more.
all is now set for students in exiting classes in Imo State to resume ahead of the WAEC examination scheduled for later this month. This is according to the Imo State government. The Commissioner for Education said about 600 public and private schools penned down to be examination centers for the WAEC examination have been fumigated with provision of infrared thermometers, hand sanitizers, and other modalities put in place to contain the spread of the coronavirus disease in schools when they resume.
The monitoring exercise that we have conducted indicates that, one, virtually all schools in Imo State, when I mean all schools, only schools that will be taking the WAEC examination exit classes. All other states that are not designated as WAEC centers will wait a little bit before we reopen them. It's only the governor that can say we are ready and ultimately say the date for the resumption of schools.
The students are now anxiously waiting for the government to announce their resumption date ahead of the WAEC examination. We'll continue to bring you details of this as it unfolds. From Owerri, the Imo State capital, Eyitokwe Kutei for COVID-19 update.
Moving on to Akure State, where many schools reopened on Monday after the government's prolonged lockdown due to the COVID-19 pandemic outbreak. However, today's school resumption recorded a low turnout of students than expected in some of the states, as parents refused to let their children return to school as COVID-19 cases rise.
Secondary school students in the final year in Akure State have resumed 1 week after the state government reopened schools. As observed when we went round, most of these schools have all the necessary facilities recommended for safety of students and teachers against COVID-19. The halls to be used for their examinations have also been arranged in line with the physical distance prescribed at the moment.
The students, they follow the government protocol by using their nose mask, and they have settled. Those who did not inform the principal they are coming, that came this morning, she had been attending to them. They use thermometer. Everybody that entered the compound, they use thermometer to test them whether they have high temperature or not. So they have applied that.
The governor of the state, Dr. Omar yesterday visited some schools across some local government areas in the state to ascertain the level of preparedness and to prompt stakeholders about the right actions.
We will try everything to ensure that all our schools where these exams are taking place are strictly monitored to ensure adherence to the protocol that we have and guidelines that we've shared with the principals.
The governor advised parents who may be jittery or skeptical at this time to calm down, as the state government will be responsible and responsive enough to monitor and manage the situation across all the schools.
You know, we still have the task force, which I head, and the task force that Professor Aluko coordinates. That has not been disbanded. That task force will continue its work. The Ministry of Education also has its own team responsible for monitoring. So, and I will continue my random monitoring in the course of that period.
The state government has also announced earlier that some of these teachers and students will be randomly tested for COVID-19 so as to gauge the level of risk. Babajide Agbeyo for COVID-19 update.
From that update in Ekiti, we'll take a break. When we come back, we'll talk to some of the most important stakeholders in this business, the administrators and the physicians. Please stay on with us. Thanks for staying with us. Welcome back to our COVID-19 update. Let's take a slightly deeper look at the issue of the schools reopening. Of course, more and more institutions and states are reopening for those exit classes. Joining us from our studios in Kano is Alhaji Mohammed Sanusi Said Kiru. He is the Commissioner for Education in Kano State. Good evening, Honorable Commissioner. Thank you for your time this evening. Honorable Commissioner, can you hear me? Good evening and thank you for your time. Okay, while we try to correct whatever it is that's going on with
Well
the
done. How are you?
Okay, so now it appears as if Alhaji Sanusi Said Kiru. Can you hear me now? You can hear me. Good evening. Welcome to the program. What is the situation? What is the situation with schools in Kano?
Hello.
Okay, we don't seem to have him. Let's go to Port Harcourt instead, then, shall we? Where Dr. Omar Maduka, consultant public health physician, chairman of the Association of Public Health Physicians of Nigeria in Rivers State, joins us also via Skype. Good evening, Dr. Maduka. Thank you for your time. Welcome to the program.
Thank you. Good evening. I'm happy to be here.
Well, can you give us an idea? What do you make of what has happened so far? The schools have reopened cautiously, slowly. Some opened last week, Monday. Some are opening this Monday. Some are even opening after today. That spacing out, in your view, is it good for being able to monitor compliance and make corrections where necessary?
Yes, I think it's a pretty good idea, and I think that's the way to go. The idea to bring in the exit classes, SS3, GS3, and all to kind of out the way different states reopen and the speed with which they call students back. It's a pretty good idea, especially if we're doing the surveillance that we need to do and keep a watchful eye on what is going on in the schools to see if we can pick up if we can pick up cases, and that will help to build the confidence to continue to reopen schools and maybe even call other classes back as time goes on. Still a bit cautious, and there's a need for watchful optimism.
Let me bring the situation to where you are, which is Port Harcourt, and then take it from there and look at Rivers State in general. What's the situation like in Rivers State?
Schools were called back as effective date was Wednesday last, and but different schools have reopened at different times. Some schools opened as early as that Wednesday. Many other schools opened today at the beginning of the week, and you see the exit classes, students going back to school. Some fear, some concerns, some excitement. It's a mixed bag of feelings. But when you go across the schools, you see various schools trying to do the best they can to actually meet up with the recommended guidelines on how to keep the students and the staff. You see posters on the gate talking about no face masks, no entry, alerting students to the issues of physical distancing and the things they can or cannot do, no handshake, no hugging, no playing at close range. And you see all these things going on. And when you get into the gates, you see the temperature, thermometer scans, infrared thermometer scans. You see them enforcing hand washing, face mask wearing, face shield wearing. And then some schools have even gone the extra mile to do this body spray mist fog thing that sprays a low percentage of chlorine liquid all over the children. It's just so much going on, just trying to ensure that the concern will be sustained. It's not something that needs to be done one-off for a few days. Is this something that we can sustain? Or are we going to go back to the old ways of beginning to wear face masks and then after a while nobody's wearing it again?
Of course, that brings up the other side of all of this, which is the medical side of it. What we've talked about now is administering the protocols. But these particular set of, of the students, those in the exit classes, we listened to the Minister of State for Education earlier on today saying that the federal government's worry from their own preliminary reports on enforcement and compliance is that while all of this goes on in the run-up to the classes themselves, in the immediate aftermath of classes, you find that the students are hugging and shaking hands and all of that. afterwards, on their way possibly away from school after the classes. What can we do about that? Is there anything anyone can do about that?
Difficult thing, the entire process is the maintaining physical distancing. It seems to be a big challenge, and of course the face mask wearing. So you see where within the premises, the four walls of an educational institution, such things can be enforced if the administrators and the teachers are serious. Then once they leave the gates, they go back to doing whatever it is that they do. It's really difficult. So the best that can be done is the temperature scans, the hand washing, to continue to enforce it and continue to talk to the learners, explaining to them that these are not measures for school alone. These are measures that need to be put in place everywhere these learners and these students go. It will go a long way. Of course, parents too have a big role to play, because a lot of the behavior of the children, a lot of the behavior of these learners come from what they are seeing their parents, the mindsets, the attitudes that the parents have. It's really important for us to continue to talk to ourselves as a country and as a people, that we need to continue to put those preventive measures in place.
The other thing here is that all along, part of the worry with reopening or not reopening schools was that maybe the students themselves in the schools were not too vulnerable to COVID-19, but they could take it from school and take it home to where older people who are a lot more vulnerable are. What do you think has been done, or is there anything that could be done to mitigate those movements, particularly because this is happening outside of the school and you don't know what it is that goes on outside of school?
Okay, so as a public health physician, one of the reasons why I support the cautious reopening of schools is because the science so far has not shown us that children are a group of people who are very effective transmitters of the COVID-19 virus. As a matter of fact, every research all over the world that I have looked at, listened to, and observed over a period of a few past days, weeks, and months show that children are less affected. Nigeria right now, would have up to 2% of all the cases being children. And the younger they are, the less likely they are to be able to infect. And even when they do get infected, if they do get a few numbers of children that get infected, they are less likely to transmit, and they are less likely to suffer from some severe severe conditions or COVID-19. They are more likely to be asymptomatic or mild cases. So the fear that the children will get it from school and come back and infect adults is not science-backed, actually, at this particular point in time. That doesn't mean we should throw caution to the wind. That doesn't mean we should behave anyhow, because the science also shows that the older the child is, the children in their teenage years mimic adults in their ability to be effective transmitters and spreaders of the disease of COVID-19 virus. So we need to have some caution there and continue to implement preventive measures at all times. In fact, what is more likely to be a scenario that will play out in schools if we're not careful is that children will take it from home and take it into the schools, may possibly infect each other, possibly infect teachers, and so on and so forth. But because school is more of a controlled environment, more likely to be better controlled in places where things are being done properly than home. But so my point is that the science doesn't back up the fact that children will go around spreading the virus everywhere. It just doesn't at this particular point in time.
Dr. Omar Maduka, thank you so much for your time and for your perspective on this very important issue. Thank you for your time on the program.
Thank you very much. Thank you.
Let's go back to our Kano studios now, where I understand that Alhaji Mohammed Sanusi Said Kiru, the Commissioner for Education in Kano State, can now communicate with us, and we can now communicate with him. Alhaji Said Kiru, welcome to the program. Thank you for your time this evening. What is the situation with schools reopening in Kano?
Thank you very much for giving me the opportunity to talk on the schools reopening in Kano. In Kano, we have 538 WAEC registration centers, and out of which 199 centers belongs to public schools. Out of this 199, we also have 33 boarding schools. All the remaining centers belongs to the private schools. But in our last council meeting, State Executive Council meeting, I presented a paper before the council in which I requested the state government to kindly fumigate all the 538 centers, which His Excellency accepted, and we are now almost 90% completion of these projects. So we also the council also granted approval to provide all personal protective equipments to these 538 examination centers. So I am happy to report that the state government provided face masks, sanitizers, soap, and infrared thermometers to all the centers. So
when
our students are now back.
When are the schools expected to reopen?
We have already reopened our school. We started with boarding schools on Sunday, on the 9th, while the day students reopened today. And our students are already in school. So there is no more any problem. So far, so good. I have taken around some boarding schools yesterday, along with my management staff. We have seen the arrangement, all the protocols set aside. We have seen them, and there is no problem.
Going forward, I mean, this is for exit classes that you're talking about. That's for those who are sitting examinations. And in your statement, you did mention that many of these are private. The examination centers are owned by the private schools, and they are affiliated to private schools. How much synergy is there between government's efforts and those private schools to ensure that the protocols that you have agreed should be put in place are in place and they remain in place after the opening?
You see, in Kano, we have a dedicated private school management board. This management board is in charge of all private institutions in the state. And whatever we are doing, the ministry is doing, we do it through the management board. And before we even agree to accept the proposal for the opening of private schools, we had to ensure that all the protocols outlined by the federal government task force on COVID-19 had been duly complied with. Personally, I have gone around some private schools. They have even written to me requesting me to go and see and inspect what they have on ground. And also 90% of these schools were also inspected by this private institutions management board. So we agreed, we look at the checklist, we certified the checklist, we certified their readiness, and that is why we even agreed to open the private schools too. So I don't think, and this is a continuous process. We already have a monitoring and evaluation unit in the ministry and in the management board, private schools management board. So it is an ongoing thing. We will continue to monitor their conduct. We are going to continue to monitor their operations throughout the examinations period and beyond. So I want to assure you that there is no problem, and even tomorrow and throughout the week, we will continue to inspect all these, both the public and private schools.
Alhaji Mohammed Sanis Eastside Kuru, thank you so much for your time on the program this evening. Thank you for bringing us up to speed with what is happening in Kano. Outside our shores, expectations are high that the South African government may make pronouncements regarding the relaxation, that is the further relaxation of the COVID restrictions in that country this week. The National COVID Command Council is expected to meet in a day or two, and people are eager to know if the country is moving to a lower COVID alert level. For that and other COVID-related developments in the country, here's Betty Dibia with the details.
Grade 7s in South Africa's public schools will once again return to school as part of the phasing in of pupils back to school. The Department of Basic Education released a statement today appealing to communities to protect schools against groups threatening to close schools and disrupt learning. With more than 3.2 million tests done, the country's recovery figures have risen to about 73%. New confirmed cases are still high, but fewer than experienced in the past weeks. And the death toll is heading towards 11,000. To improve awareness in communities, the Department of Social Development is using the Pink Drive campaign for cancer awareness to not only enlighten and screen men and women for cancer, but also for COVID-19 screening and testing.
This is a new addition to our outreach, and the message is the same: early detection saves lives.
There is high expectation that the economy could be opened up further within the week, and the Premier of the Western Cape, Alan Winde, believes his province is good enough to go to a lower COVID alert level.
We also know then that our hospital system sitting at 69% capacity gives us the opportunity to now push for the opening of the economy. And obviously doing that responsibly, making sure that we do that in the new normal space, but definitely we need now to save jobs and we need to be able to open the economy.
The National COVID Command Council and the wider cabinet may meet on Tuesday or Wednesday to decide where next the country is headed, especially as the national state of disaster is expected to lapse by Friday, the 15th of August. From Johannesburg, South Africa, Betty Dibia, Channels Television News.
Let's talk to Betty now, who joins us via Skype from the commercial capital of South Africa, Johannesburg. Good evening, Betty, and welcome to the program. This Command Council meeting for much later in the week, there's been so much speculation about it. What are the expectations really? What are people expecting?
For starters, those who deal in alcohol, those who deal in cigarette, that's a huge industry. You know, alcohol is not just beer. You have a huge wine producing industry in the country. So those ones are waiting. And people, events, it's still a little too early to expect that. But if this is a hosting country for so many conferences, so many events. They have the infrastructure in place. So many people, and then there are associated service providers to that industry. So many people are hoping that probably they'll move down to level 2 and allow a few other events to happen, especially now that death toll is still going high, but confirmed cases, we were witnessing 13,000, 11,000 and all that. At a point, I think last week we got 414 deaths in a 24-hour period. That seems to be reducing. The recovery rate is much higher. You have, as at yesterday, over almost 560,000 confirmed cases, but out of that, 411 point something are recoveries. So people are hoping that more than the tourism industry, is suffering a lot as well. We know that so many associated service providers as well. So that's what they're looking at. Cabinet usually meets, I think, on Tuesday or Wednesday. We have the briefing on Thursday. So hopefully, maybe there'll be another presidential speech later in the week.
The National COVID Command Council is under tremendous pressure from the provinces to open up various things that give advantage to those provinces. We saw the Premier of the Western Cape there in your report. How much pressure is there, and how is that being dealt with, you think?
There is a lot of pressure on the government. But, you know, it's still trying to balance. It's overused cliche, you know, lives or livelihood. So the government, now again, one thing, by the 15th of this month, the extension of the national state of disaster, which empowers the government to do what they're doing, will lapse. I don't know if it's going to be extended. It's been extended about twice by Friday. So hopefully something has to give. The Western Cape, if you recall, a few months back, was the epicenter. We witnessed a spike in numbers. That has reduced quite a lot. It's become a bit steadier. With even Gauteng, you have a lot of recoveries in Gauteng. So there is a lot of pressure. There are some court cases. The tobacco industry is up in arms against government for them to unban the sale of tobacco or tobacco products. And then the alcohol industry, they're still pleading for the government to The problem is this: there are so many other industries linked together, and when one major one is dormant, others are affected. So there is tremendous pressure, but I believe they've loosened up a little bit tourism for local tourism within each province, not across provinces. So maybe now they will allow more trans-province tourism or travel for leisure, and that way the airline industry as well, the local aviation industry, will see more passengers, to ferry across.
There is the question, of course, the ever-present question of schools reopening. In your report, you also talked about grade 7s this time. We seem to, the last time we were talking of grade 12s, which are older pupils. Grade 7s are much younger. What's that like, and what's the response been like?
That's for public schools. I remember I told you once, South Africa has two systems. You have the 3-term systems and the 4-term systems. Most public schools use the 4-term system, and then most private schools use the 3-term system. Private schools are on holiday right now. We'll be resuming, many of them, on the 1st of September. There isn't much in terms of resistance, but there are still concerns for some of the schools, especially in the rural areas, meeting up with requirements for hygiene, the safety of the children, and all the things required to keep them safe from COVID and all other things. So there isn't as much resistance as previously witnessed, maybe because numbers are sort of going down a little, or the critical numbers are going down, but there's more. There's still people who are threatening that they will shut down schools or interrupt learning. Some parents have been involved in these protests as well. That's why the Minister for Basic Education is appealing to the communities themselves to protect the schools and not allow anybody to disrupt. Whereas there are some members of these communities who are part of the protest. So they will resume tomorrow. That's grade 7s, because they will be heading to high school in January. But some of the schools, there's a category they call Model C schools. They're neither private nor public. Those ones have sort of met the requirements, and they've applied. They've given them what they call deviation provision, which means they can go ahead and resume. So some of them will be resuming tomorrow, Tuesday or Wednesday, where for a particular school close by, grades 4 to 7 will be resuming on Wednesday. The grades 1 to 3, I think a week later. But for now, I think people are actually eager to just make a little bit of progress, although safely as well.
Thank you very much, Betty, for your reporting tonight. Thank you. And do stay safe. Lebanon's main COVID-19 hospital in Beirut, the Rafik Hariri University Hospital, is said to be close to capacity after a spike in infections, and last week's explosion led to an influx of patients. The chief executive of the hospital, Dr. Firas Abiad, says there's been an exponential rise in the number of COVID-19 cases recently in the country. More than 100 new infections have been recorded every day since July the 21st, placing a strain on Lebanon's healthcare system. This comes just as the Lebanese government resigned this evening amidst mounting anger over last Tuesday's explosion. Many have accused leaders of culpability through their alleged negligence and corruption. Here are the stories in our global update.
As COVID-19 infections in Latin America top 5.5 million, Brazil has recorded more than 100,000 deaths linked to COVID-19, the world's second highest figure, as the outbreak in the country shows no sign of easing. Meanwhile, the number of infections and deaths in the United States has also reached new heights. America and Brazil are two countries that have struggled to bring their outbreaks under control. The U.S. has seen more than 5 million infections and 162,000 deaths to date. Parisians and holidaymakers strolling along the banks of the river or browsing open-air markets in Paris must now wear a face mask from Monday after authorities imposed new measures to curb a rise in coronavirus infections. And for 101 days in a row, New Zealand has reported no locally transmitted cases of coronavirus. That feat has been hailed as a significant milestone by the country's Prime Minister Jacinda Ardern, whose COVID-19 containment strategy has received international plaudits.
Actually, 100 days doesn't change anything for New Zealand. It doesn't make it any less likely. We are still having to, of course, manage our borders very, very carefully. 100 days is a milestone to mark, but again, we still need to be vigilant regardless.
The 21 active cases of coronavirus in the country are all imported cases from people arriving in New Zealand who are in managed isolation.
That's our COVID-19 update program for tonight. You can take a closer look at some of the COVID-19 numbers by visiting our website, channelstv.com. There you'll get more updates and a better understanding of all the protocols during this time. There's also more on figures and numbers of recoveries in Nigeria, Africa, and the world. And of course, there are other stories on politics, business, and sports. I'm Ladi Akere. Thank you very much for watching. Do stay safe.